ಮ್ಯಾಮ್, ಕೀಮೋಥೆರಪಿ ಅನ್ನುವಂತಹ ಒಂದು ಡ್ರಗ್ನ ಒಂದು ಪ್ರಾಕ್ಟೀಸು ಎಷ್ಟು ವರ್ಷಗಳಿಂದ ಇರ್ಬೋದು? ಅಂದರೆ ಮೆಡಿಕಲ್ ಸೈನ್ಸ್ಗೆ
From 1950 onwards.
ಫ್ರಮ್ 1950.
So 1950 onwards, almost 75 years we have been giving.
ಸೊ ಅದಕ್ಕಿಂತ ಮುಂಚೆ ಒಬ್ಬ ಮನುಷ್ಯನಿಗೆ ನೀವೇ ಹೇಳಿದ್ರಿ ಇದಕ್ಕೊಂದು ದೊಡ್ಡ ಹಿಸ್ಟ್ರಿನೇ ಇದೆ ಕ್ಯಾನ್ಸರ್ಗೆ ಅಂತ. ಸೊ ಆಗೆಲ್ಲ ಯಾವ ರೀತಿ ಟ್ರೀಟ್ ಮಾಡ್ತಾ ಇದ್ರು?
See, there were the people used to do previously surgeries, we would do radiation. All those were part of treatment as well. But chemotherapy in a structured way, use of chemicals in a structured way started in 1950.
ಸೊ ಅಂದರೆ ಇದನ್ನ ಎಲ್ಲ ರೀತಿಯ ಬೇರೆ ಬೇರೆ ಟ್ರೀಟ್ಮೆಂಟ್ಗಳ ಮೂಲಕ ಗುಣಪಡಿಸ್ಬೋದು, ಆದರೆ ಇದೊಂದು ಸ್ಟ್ರಕ್ಚರ್ ಮಾಡಿದ್ರು ಅಷ್ಟೇ. ಈ ಥರ ಇಷ್ಟನ್ನ ಹೀಗೆ ಹೆಂಗೆ ಬಳಸಬೇಕು,
that too. And actually modern chemotherapy or modern treatment actually started in 1975 after 1975. So it's just 50 years that we have been using modern type of treatment, which includes chemotherapy, biologic therapy, immunotherapy, new type of surgeries in which you do more and more organ conservation. You try to conserve more and more organ. You don't, if you have a problem in the bladder, you just don't remove the bladder. You try to conserve bladder as much as possible. If you have tumor in the stomach, you try to conserve as much stomach as you can. If you have tumor in the breast, as much breast you can conserve. So organ conserving surgeries, more and more focused radiation. All these have started from mid 70s. The era has started, and every year we have new technology, we have new medicines. Every month we have new drugs. So a lot is changing. Every day we have to find out what new is happening. If we lose on that, we may not be treating our patients appropriately.
ಓಕೆ. ಸೊ ನಿಮ್ಮ ಹತ್ರ ಪೇಷಂಟ್ಸ್ ಬರುವಾಗ ಅವರು ಕನ್ಸಿಡರ್ ಆಗೇ ಬಂದಿರ್ತಾರೆ ನನ್ನ ಕ್ಯಾನ್ಸರ್ ಇದೆ ಅಂತ ಹೇಳ್ಬಿಟ್ಟಲ್ವಾ, ಆಲ್ಮೋಸ್ಟ್ 90% ಆಫ್ ದ ಪೀಪಲ್. ಸೊ ಅವರಿಗೆ ನೀವು ಹೇಗೆ ಧೈರ್ಯ ತುಂಬ್ತೀರಾ ಅಂತ? ಯಾಕೆಂದರೆ ನೀವೇ ಹೇಳಿದ್ರಿ ಇಟ್ಸ್ ಅ ಸಿಚುವೇಶನ್ ಆಫ್ ಡೆತ್. ಅಂದರೆ ಒಬ್ಬ ಮನುಷ್ಯನಿಗೆ ಕ್ಯಾನ್ಸರ್ ಬಂದಿದೆ ಅಂತಂದರೆ ನನ್ನ ಜೀವನದ ಕಡೆಯ ಅಧ್ಯಾಯ ಅಂತ ಹೇಳಿ ತುಂಬ ಜನ ತೀರ್ಮಾನ ಮಾಡ್ಕೊಂಡ್ಬಿಟ್ಟಿರ್ತಾರೆ. ನನ್ನ ಲೈಫ್ ಮುಗೀತು, ಮೈ ಲೈಫ್ ಹ್ಯಾಸ್ ರುವೆಂಡ್. ಅಂಥವರು ಕೂಡ ಇವತ್ತು ಬದುಕನ್ನು ಚಾಲೆಂಜಿಂಗ್ ಆಗಿ ತಗೊಂಡು ಕ್ಯಾನ್ಸರ್ನ ಗೆದ್ದು ಬದುಕ್ತಾ ಇರುವಂಥ ಉದಾಹರಣೆಗಳು ನಮ್ಮಲ್ಲಿ ಬಹಳಷ್ಟಿದೆ. ಇದೇ ಕೀಮೋಥೆರಪಿ ಎಷ್ಟೋ ಜನರಿಗೆ ಮತ್ತೆ ಜೀವನವನ್ನು ಕಟ್ಕೊಟ್ಟಿದೆ. ಸೊ ಈ ನಿಟ್ಟಿನಲ್ಲಿ ನಿಮ್ಮ ಹತ್ರ ಬರುವಂಥವ್ರಿಗೆ ನೀವು ಹೇಗೆ ಧೈರ್ಯ ತುಂಬ್ತೀರ?
See, first important thing is it is not a death sentence. It is just a difficult journey. Maybe a small journey, maybe 3 months, maybe 5 months. It's just a journey. But hopefully, and everybody's intention is things should be good beyond that journey. So it's a small, difficult journey, but the end result hopefully should be good.
ಸೊ ನಿಮ್ಮಲ್ಲಿ ಆಂಕಾಲಜಿ ಡಿಪಾರ್ಟ್ಮೆಂಟಲ್ಲಿ ಮ್ಯಾಮ್ ಈಗ ನನಗೆ ಗೊತ್ತಿರೋ ಪ್ರಕಾರ ತುಂಬ ಡ್ರಗ್ಸ್ಗಳು ಡೇ ಬೈ ಡೇ ಇಂಟ್ರೊಡ್ಯೂಸ್ ಆಗ್ತಾನೇ ಇರುತ್ತೆ. ಸೊ ಅದನ್ನು ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡುವಂಥ ಡಾಕ್ಟರ್ಸ್ಗಳು ಹೊಸದಾಗಿ ಬರುವಂಥವ್ರು ಸುಮಾರು ಜನ ಇರ್ತಾರೆ. ಬಟ್ ನಿಮ್ಮ ಪ್ರಕಾರ which is the best therapy for cancer?
It's not a straight answer. The best therapy is what is customized and tailor-made for every patient. Every patient has, you have to see what is the type of
ಅಂದ್ರೆ ಈಗ ಒಬ್ಬ ಮನುಷ್ಯನಿಗೆ ಕ್ಯಾನ್ಸರ್ ಇದೆ, ಅವನಿಗೆ ಇದು ಫಿಕ್ಸು ಇಟ್ಸ್ ನಾಟ್ ಫಿಕ್ಸ್.
ಏನ್ ತರ ಫಿಕ್ಸ್ ಇಲ್ಲ, ಇಟ್ ಇಸ್ ನಾಟ್ ಫಿಕ್ಸ್ಡ್. ಎವ್ರಿಬಡಿ ಹ್ಯಾಸ್ ಡಿಫ್ರೆಂಟ್ customized treatment. It is known as personalized care. It is known as tailor-made care. So you tailor-make it for one person. This is the most appropriate treatment for one person. Same stage, different patient, different treatment. It cannot be same. It's not a formula treatment which we use for everybody. Everybody has little difference. Everybody has fitness which is different, age which may be different, stage, subtype of cancer.
Some common cancer ಅಲ್ಲಿ ಅಂದರೆ ಜನಸಾಮಾನ್ಯರಲ್ಲಿ ಕಾಮನ್ ಆಗಿ ಕಂಡು ಬರುವಂತಹ ಒಂದಷ್ಟು ಸಾಮಾನ್ಯ ಕ್ಯಾನ್ಸರ್ನ ಗುಣಲಕ್ಷಣಗಳು ಅಂದರೆ ಯಾವ್ಯಾವುದು ಮೇಡಮ್?
See, one of the common cancers is lip and oral cavity cancer. So any ulcer in the lip or the mouth, how you should know is, first is, are you a tobacco chewer? Are you an alcoholic? Do you have any risk factor? These are the general risk factor. Or any tooth which is irritating. Go in front of a mirror, do a self-examination of the lip, mouth, neck, and see if there's any ulcer, any redness, any white patch, any tight patch which you see. You should get yourself checked. This is for oral cavity and lip cancer. Lung cancer, any chronic cough, if you have early morning cough, if you bring out blood at any point in time, if while coughing, if you have chest pain, please, and if you have a risk of any addiction, you should visit a doctor. They may ask for a chest x-ray after examining you. And if you are a chronic smoker, they may even ask for a CT of the chest. For a woman, breast cancer is one of the commonest cancer. Any lump, any nipple discharge, redness, not just in the breast, in the underarm, in the neck area. For cervix cancer, any foul smelling discharge, any bleeding, not related to periods, but even otherwise. Anything which is causing pelvic pain, which is persistent, urine discomfort, which is persistent, you should visit a doctor. Blood in stools. If you have motion with blood, most of the patients will call it piles. But please get yourself checked whether you are missing something. Any blood in stools along with any altered bowel habit. You may have constipation or you may have diarrhea which is persistent for a long time. Any unexplained weight loss which you have not voluntarily, consciously done. Visit a doctor whether you have actually had unintentional weight loss which could be related to some internal process going on. Obstruction in the throat, you have any kind of swallowing difficulty, chronic stomach pain, if you feel any mass in any part of the body, these are some of the things which you should bring to medical attention.
ಮೇಡಮ್, ಈಗ ಈ ಥರ ಕಂಡು ಬಂದವರಿಗೆ ಯಾರಿಗೆಲ್ಲ ಯಾವ ಥರ ತಮ್ಮ ಲೈಫ್ ಸ್ಟೈಲ್ನ ಬದಲಾಯಿಸ್ಕೊಂಡ್ರೆ ಕ್ಯಾನ್ಸರಿಂದ ವಿಮುಕ್ತಿ ಆಗ್ಬೋದು, ಅಂದರೆ ಒಂದು ಸ್ವಲ್ಪ ದೂರ ಉಳಿಬೋದು. ಕ್ಯಾನ್ಸರ್ ಬರುತ್ತೆ ಅನ್ನೋ ಒಂದು ಭಯದಿಂದ ಅಟ್ಲೀಸ್ಟ್ ಲೈಫ್ ಸ್ಟೈಲ್ನಾರು ಬದಲಾಯಿಸ್ಕೊಳ್ಳಿ ನಮ್ಮ ಜನ. ಯಾವೆಲ್ಲ ಲೈಫ್ ಸ್ಟೈಲ್ನ ಒಂದು ಚೇಂಜಸ್ನ ಬದಲಾಯಿಸ್ಕೊಳ್ಬೇಕು?
Most important thing we need to know is cancer is a lifestyle disease. So changing your lifestyle can actually reduce your risk. And why we are getting so much cancer now, even in India, is also because we are acquiring westernized lifestyle, more processed food, ultra processed food, more westernized lifestyle in which we have less physical activity, of course more stressful life. But all these are complex factors. What you can do to prevent yourself? Well, at least do 30 to 40 minutes of exercise every day. At least 150 minutes of some basic exercise every day. It could be walking, running, swimming, jogging, anything. But at least 150 minutes of physical activity per week. That is what is recommended. Have rich fruits and vegetable rich diet. So at least more than 100 grams of fruits and vegetable each day is recommended. It could be 4 to 5 servings per day. It could be one fruit in the morning, afternoon one sprout, or evening one bowl of salad. This could be one ideal thing. Make sure that once a year you get yourself tested. As often as possible, if it is feasible, keep your stress levels low. Now that stress levels could be low by choosing a physical activity which calms you down. It could be some kind of meditation, it could be mindfulness of any sort, it could be yoga, pranayam. Make sure you examine yourself, you examine your oral cavity, neck, you examine your skin for any skin changes, which could also be sign of a problem. And generally make sure that you are vigilant about yourself.
ಮೇಡಮ್, ಜನಸಾಮಾನ್ಯರಲ್ಲಿ ಅರ್ಲಿ ಡಿಟೆಕ್ಷನ್ ಅಂದರೆ ಕ್ಯಾನ್ಸರ್ನ ಒಂದು ಅರ್ಲಿ ಡಿಟೆಕ್ಷನ್ ಯಾಕೆ ಮಾಡಿಸ್ಬೇಕು ಆ್ಯಂಡ್ ಮಾಡಿಸಿದ್ರೆ ಉಪಯೋಗ ಏನು? ಆ್ಯಂಡ್ ಗೊತ್ತಾಗಬೇಕು ಅಂತ ಅಂದರೆ ಈಗ ನೀವು ಆಲ್ರೆಡಿ ಸುಮಾರು ಉದಾಹರಣೆಗಳನ್ನ ಹೇಳಿದ್ದೀರಾ. ಯಾಕೆ ಮಾಡಿಸ್ಬೇಕು ಅನ್ನೋದು ಜನರಿಗೆ ಒಂದು ತಿಳುವಳಿಕೆ ಥರ ಹೇಳೋದಾದರೆ?
ಸೊ ಸಿಂಪಲ್ ಥಿಂಗ್ ಇಸ್ ದ್ಯಾಟ್ ಇಫ್ ಯು ಆರ್ ಡಯಾಗ್ನೋಸ್ಡ್ ಆನ್ ಟೈಮ್, the early diagnosis mostly will have curative cancers and results of treatment will be extremely good. And that's the whole reason why we advocate awareness, so that you can find out early symptoms, early signs, go to a doctor early, and when your cancer is diagnosed, it's an early stage which is curable. Also remember that sometimes we find it in situ stage, means stage 0, or sometimes pre-cancerous stage. So that if you find out, you actually prevent cancer from happening. So there are certain things in which you are doing regular pap smear and you find certain changes, cervical erosions or certain in situ carcinoma. When you treat it, patient may not even develop cancer. Just do a mammogram. You may find ductal carcinoma in situ, which can happen 3 to 5 years prior to having cancers. And when you find out, you actually can kind of prevent cancer from happening. So remember that educating yourself, knowing what to find out, can actually even prevent cancer.
ಮೇಡಮ್, ಫಸ್ಟ್ ಟೈಮ್ ಅಂದರೆ ಇವಾಗ ಕ್ಯಾನ್ಸರ್ನ ಡಿಟೆಕ್ಷನ್ ಆದಾಗ, ಲೈಕ್ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ 1 ತಿಂಗಳಲ್ಲಿ 2 ತಿಂಗಳಲ್ಲಿ ಡಿಟೆಕ್ಷನ್ ಆಯಿತು ಅಂದರೆ, ಇವಾಗ ಜನರಲ್ಲಿ ಒಂದು ಮೂಢನಂಬಿಕೆ ಇದೆ, ಕ್ಯಾನ್ಸರ್ ಅಂತ ಅಂದರೆ ಲಕ್ಷಾಂತರ ರೂಪಾಯಿ ಖರ್ಚಾಗ್ಬಿಡತ್ತಪ್ಪ, ವಿ ಕಾಂಟ್ ಬೇರ್ ಇಟ್. ಸೊ ಹೌದಾ, ಲಕ್ಷಾಂತರ ರೂಪಾಯಿ ಖರ್ಚಾಗುವಂಥ ಒಂದು ಟ್ರೀಟ್ಮೆಂಟ್ ಇದು?
Yes, it is a technology which is expensive, but remember that there are initially to diagnose, they are very simple tests, and quite a few things can be done with basic management, which does not involve too much cost. So it is more a myth than a reality. But yes, there are certain new technologies which could be expensive. There are new medicines which require a lot of research, which are imported. There are a lot of technologies which we get from across the globe. Those technologies could be useful in certain stages and could be expensive, but not everything is expensive. And of course, there is so much support. There is public-private partnership, and there are so many drugs. Importantly, I mean, with this budget, I mean, there is so much of focus on cancer drugs. A government has taken steps to reduce GST, has taken steps to reduce the cost of so many drugs. In the past several budget, the primary focus of the government has been to reduce the cost of cancer treatment. So a lot has happened, a lot has changed. Talk to your doctor. Even if the technology, some of the technology like transplant and all could be expensive, but there are so many crowdfunding platforms which help you. If you go and talk to your doctor, they will tell you donors who actually want to help such patients. There are so many schemes which help some patients. So just make sure you have a communication and not think that it is very
ತುಂಬಾ
expensive.
NGOಗಳು ಕೂಡ ಮುಂದೆ ಬರ್ತಾ ಇದಾವೆ ಕ್ಯಾನ್ಸರ್ ಪೇಷಂಟ್ಗೆ ಟ್ರೀಟ್ ಮಾಡೋದಕ್ಕೆ. ಅಂಡ್ ದೊಡ್ಡ ದೊಡ್ಡ ಬಿಲ್ಡರ್ಸ್ಗಳು ಲೈಕ್ ಹೂ ಹ್ಯಾಸ್ ಕ್ರೋರ್ಸ್ ಆಫ್ ರುಪೀಸ್, ದೇ ಆರ್ ಹೆಲ್ಪಿಂಗ್ ಫ್ಯೂ ಪೀಪಲ್ ಲೈಕ್ ಕ್ಯಾನ್ಸರ್ ಪೇಷಂಟ್ಸ್ಗೆ. ಸೊ ದೇ ವಾಂಟೆಡ್ ಟು ಡೂ ಸಮ್ ಸೊಸೈಟಿ ಕೈಂಡ್ ಆಫ್ ವರ್ಕ್ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು. ಸೊ ಮೇಡಮ್, ಫಸ್ಟ್ ನನಗೇನಾದರೂ ಒಂದು ತಿಂಗಳಲ್ಲಿ, ನನಗೆ ಕ್ಯಾನ್ಸರ್ ಬಂದ ಒಂದು ತಿಂಗಳಲ್ಲಿ ನನ್ನ ಬಾಡಿಯಲ್ಲಿರುವಂತಹ ಯಾವುದಾದ್ರೂ ಒಂದು ಪಾರ್ಟ್ಗೆ, ಯಾವುದಾದ್ರೂ ಒಂದು ಆರ್ಗನ್ಗೆ ಕ್ಯಾನ್ಸರ್ ಡಿಟೆಕ್ಟ್ ಆಯಿತು ಅಂತ ಹೇಳಿದ್ರೆ, ನಾನು ಅರ್ಲಿ ಬರೋದ್ರಿಂದ ನಿಮ್ಮ ಹತ್ರ ನನ್ನ ಇಡೀ ಆರ್ಗನನ್ನು ಡ್ಯಾಮೇಜ್ ಆಗೋದನ್ನು ತಡೆಗಟ್ಟಬಹುದಾ?
This is not again one answer. It depends on which organ, which type of cancer. Every cancer, sometimes if you have some cancers, it may be in an organ, but you don't even need to touch that organ. Only medicines can take care of it. So the answer is every cancer is unique, and that is the theme of World Cancer Day. United by unique. So every cancer is unique, and yes, the intention is to save the organ. The intention is to preserve the function of the organ, but sometimes we don't even have to touch the organ even if it is affected with cancer. Like a lymphoma, for example, a lymph node cancer. We don't have to remove the lymph node. We just remove the lymph node for diagnosis. But for treatment, we just give some medicines which take care of it. We don't even touch that. There are a lot of techniques now, newer techniques, which don't even do surgical excision. Let's say you have a anal cancer or a rectal cancer. We may try to use therapies which actually can be in the form of medicines or other type of therapies which avoid surgeries. So it's known as sphincter sparing techniques. There are several techniques, the intention of which is to preserve the organ function.
ಥ್ಯಾಂಕ್ಸ್ ಫಾರ್ ವಾಚಿಂಗ್ ದಿಸ್ ವಂಡರ್ಫುಲ್ ಎಪಿಸೋಡ್. ಸೊ ಇದೇ ರೀತಿ ಪ್ರತಿಯೊಂದು ಎಪಿಸೋಡನ್ನು ಕೂಡ ವಿನೂತನವಾಗಿ, ವಿಶೇಷವಾಗಿ ನಿರ್ಮಾಣ ಮಾಡ್ತಾ ಇದ್ದೇವೆ. ಇದಕ್ಕೆ ನಿಮ್ಮೆಲ್ಲರ ಸಹಕಾರನೂ ಇರಲಿ. ತಪ್ಪದೇ ಸಬ್ಸ್ಕ್ರೈಬ್ ಮಾಡಿ ಕನ್ನಡ ಪಾಡ್ಕಾಸ್ಟ್. ಹಾಗೆ ಈ ವಿಡಿಯೋ ನಿಮಗೆ ಇಷ್ಟ ಆದರೆ ಮಿಸ್ ಮಾಡದೆ ಶೇರ್ ಮಾಡಿ, ಆ್ಯಂಡ್ ಡೋಂಟ್ ಮಿಸ್ ಟು ಲೈಕ್ ಅವರ್ ಎಪಿಸೋಡ್ಸ್. ಥ್ಯಾಂಕ್ಸ್ ಫಾರ್ ವಾಚಿಂಗ್. ಸಬ್ಸ್ಕ್ರೈಬ್ ಮಾಡಿ ಆ್ಯಂಡ್ ಬೆಲ್ ಐಕಾನ್ನ ಕ್ಲಿಕ್ ಮಾಡಿ so that every episode is gonna be notified. Keep watching. Spread smile forever.